Good morning. This is me, Nafisa. Let's understand the basic information on hypertension. Let's start with what is hypertension. High blood pressure or hypertension is a common condition that affects the body's arteries. Blood is carried from the heart to all the parts of the body in the vessels. Each time the heart beats, it pumps blood into the vessels. Blood pressure measures the force with which the blood flows through the arteries when pumped by the heart. If a person has high blood pressure, the force of the blood pushing against the artery walls is consistently too high. Blood pressure is measured in millimeters of mercury. In short, we write it as mmHg. Blood pressure is written as two numbers. The first, systolic number, represents the pressure in the blood vessels when the heart contracts or beats. The second, diastolic number, represents the pressure in the vessels when the heart rests in between the beats. In general, hypertension is when pressure in the blood vessels is too high, 140 by 90 mm of mercury or higher. Now let's understand what are the causes of high blood pressure. Older age over 65 years, or genetics, family history of hypertension. Certain health conditions such as diabetes, kidney diseases increases the risk for developing high BP. High BP can also happen during pregnancy. Unhealthy diet, high salt diet, being overweight, not getting enough physical activity, consumption of tobacco, drinking too much alcohol, smoking, tea, coffee, colas, anxiety, stress, missing medicines. These are the causes of high blood pressure. What are the signs and symptoms of high blood pressure? Most people with high blood pressure have no warning signs and do not feel any symptoms. Hence, they may not even know if they have high blood pressure. People with high blood pressure may experience symptoms like severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision, anxiety, confusion, buzzing in the ears, nosebleeds, abnormal heart rhythm. How is blood pressure detected? Measuring blood pressure is the best way to know whether a person has high blood pressure. Moreover, individuals can measure their own blood pressure using automatic digital home blood pressure devices, which are easy to use and are available widely. Please note, evaluation by the doctor is very important for assessment of risk and associated conditions. Please note, hypertension is a serious medical condition if not treated. Let's understand why. If hypertension is not treated, it can cause damage to the arteries. This damage to arteries may take several years. This damage allows cholesterol in the blood to collect in the artery walls, forming plaques that narrows the blood vessel. Therefore, heart needs to pump harder to supply the blood the body requires. This increases the blood pressure. Damage is done to the arteries of the heart. Also, damage is done to the arteries present throughout the body. Damage to arteries may lead to 5 serious health complications like angina, heart attack, heart failure, stroke, dementia, kidney failure, and vision loss. Let's understand one by one why these hypertensive complications are so important. High blood pressure causes damage to heart arteries, causing plaque to be formed. Plaque reduces blood flow. Less blood flow to the heart causes chest pain, also called as angina. Less blood flow to the heart, therefore heart receives less oxygen, therefore heart muscles begins to die without enough oxygen, leading to heart attack. Elevated blood pressure makes the heart work harder. This can cause the heart muscles to become thick. Hence, heart can't pump enough blood and oxygen to the other organs, hence results in heart failure. Brain requires a consistent supply of oxygen-enriched blood to perform the many tasks. Uncontrolled high blood pressure can cause the carotid arteries that supply blood and oxygen to the brain to burst or to be blocked by plaque. This reduces the blood flow and oxygen to the brain cells. Hence, the brain cells die, leading to stroke. Moreover, having high blood pressure, especially in midlife, is linked to having dementia later on in life. Adults with diabetes, high blood pressure, or both have a higher risk of developing chronic kidney disease than without these conditions. Uncontrolled hypertension results in artery damage, which will restrict the kidney's ability to filter excess fluids, toxins, and other wastes from the bloodstream. While often caused by hypertension, kidney disease can increase blood pressure even further. Increased blood pressure can injure the small vessels that supplies nutrients and oxygen to the eyes, leading to vision loss. The higher blood pressure levels are, the more risk a person has for health problems such as angina, heart attack, heart failure, stroke, dementia, kidney failure, and vision loss. Good news is that in most cases, blood pressure can be managed, which lowers the risk of serious health problems. What are the guidelines for blood pressure? Joint National Committee or JNC 8 guidelines for classification of BP in adults are as follows. If the systolic blood pressure is less than 120 millimeters of mercury and diastolic BP is less than 80 millimeters of mercury, then this individual is considered as a normal individual. If an individual has systolic blood pressure between 120 to 139 millimeters of mercury, or the diastolic blood pressure is between 80 to 89 millimeters of mercury, then this individual is classified as pre-hypertensive. If an individual has systolic blood pressure between 140 to 159 millimeters of mercury, or the diastolic blood pressure is between 90 to 99 millimeters of mercury, then this individual, as per JNC 8 guidelines, is considered as stage 1 hypertensive. If an individual has systolic blood pressure of more than or equal to 160 millimeters of mercury, or the diastolic blood pressure is more than or equal to 100 millimeters of mercury, then this individual is considered as stage 2 hypertensive. Blood pressure goal is less than 130 by 80 if a person has cardiovascular disease, heart disease or the stroke, diabetes, chronic kidney disease, high risk for cardiovascular disease. For most people, the goal is to have a blood pressure less than 140 by 90. Lifestyle changes that can help lower high blood pressure are eating healthy foods, low salt intake, losing weight, being physically active, quitting tobacco, cut down on alcohol intake, stop smoking, less tea, coffee, colas, getting good night's sleep, reduce stress, regular blood pressure checkups, do not miss medication, having medicines to control high blood pressure. In fact, by making these changes early on, a person may be able to avoid medicines. There are several classes of drugs designed to reduce blood pressure. These drugs are also called as antihypertensive drugs or antihypertensives. Most commonly used antihypertensives are ACE inhibitors, beta blockers, diuretics, calcium channel blockers, sartans, that is the angiotensin receptor blockers or angiotensin 2 receptor blockers or ARBs. ACE inhibitors or angiotensin converting enzyme inhibitors reduce blood pressure by relaxing the blood vessels. Common examples are enalapril, lisinopril, lamipril. The most common side effect of ACE inhibitors is persistent dry cough. Pregnant women should not take ACE inhibitors because they can harm the unborn baby. Beta blockers reduce blood pressure by making heart beat more slowly and with less force. Common examples are atenolol. The side effects of beta blockers are shortness of breath, dizziness, headaches, tiredness, cold hands and feet. Beta blockers cause bronchoconstriction. For this reason, they are not suitable for asthmatics. Diuretics are also called as water pills, are drugs that get rid of excess water and salt from the body through urine. Common examples are hydrochlorothiazide and chlorthalidone. Possible side effects include dizziness when standing up, increased thirst, and frequent urge to urinate. Diuretics are not suitable for people who are having gout. Calcium channel blockers reduce blood pressure by relaxing the blood vessels. Common examples are amlodipine, nifedipine, and diltiazem. The side effects of calcium channel blockers may include headaches, constipation, swelling in the ankles, or a tight feeling in the lower legs and a rapid heart rate. Drinking grapefruit juice while taking some calcium channel blockers can increase the risk of side effects. Sartans blocks the effect of angiotensin, a hormone that increases blood pressure. Common examples are losartan, olmesartan, and telmisartan. Possible side effects include dizziness, headaches, and cold or flu-like symptoms. Sartans should not be used during pregnancy. These medications prevent long-term effects of high blood pressure. It is best for the doctor to advise on the suitability of the medications for an individual. This depends on whether an individual has any other medical conditions. Need is to take blood pressure medicines lifelong. Doctor might be able to reduce or stop treatment if blood pressure stays under control for several years. It's really important to take medicine as directed. Do not miss doses. Medicine will not necessarily make a person feel any different, but this does not mean it's not working. Medicines used to treat high blood pressure can have side effects, but most people do not get any. Person should not stop medicines if he or she gets side effects. Talk to your doctor who may advise changing the medicine. Detection and proper management is important to prevent complications and ensure good health. Thank you very much.